This podcast is produced by Concierge Medicine Today, LLC. All rights reserved. Concierge Medicine Today, or CMT, was founded in 2007 and serves as the industry's trade publication and annual medical conference organizer. Please note, the information shared on this podcast and across all CMT platforms is intended for general informational purposes only and may contain errors or omissions. Nothing in this podcast nor across CMT platforms constitutes medical, financial, legal, nor professional advice. CMT is not liable for any inaccuracies. CMT encourages listeners to conduct their own research and consult trusted advisors before taking any action based on the content presented. No mention, interview, or link should be considered an endorsement. This content is primarily intended for a healthcare audience and may not apply to all listeners. Thanks for tuning in.
Well, good morning or good evening, Docpreneur Nation. You're listening to Concierge Medicine Today's Docpreneur Leadership Podcast. And today we're talking with Dr. Kat McGraw, and she is the Chief Medical Officer at Guava Health. And we're going to put the links in the show notes as well, but you can go to guavahealth.com. We're excited about this conversation in particular because we're going to talk about patient data insights from Guava. We're going to talk about leadership in healthcare and what Dr. McGraw is doing and how she's making an impact in your practice. So Dr. McGraw, thank you for being with us.
Thank you for having me. This is great.
So, you spent a couple of decades as a hospitalist, and now you sit in this chief medical officer seat. What's something from the front lines that you wish hospital leadership, healthcare leadership, and organizations that you've been a part of, you wish that they would move towards? And then we'll deep into Guava and your background in a minute.
Sure. Yeah. Well, I'll just say that I have been in hospital leadership for I would say maybe about close to 15 years total now. And I continued always to have a hand in providing medical practice, because I think that, one of the things that everybody needs to be aware of is that physicians truly, truly care about the quality of work that they do and what they're providing. And I think it's really incumbent on everybody in leadership to really facilitate that, because that's really a driving mechanism or a driving sentiment for folks who are providing care. I think we theoretically know that, but we don't realize, but folks don't realize how much administrative hurdles are truly in the way of folks being able to provide that care that they so intrinsically, just are devoted to.
Yeah. How have you been able to kind of, because I hear stories from other particular concierge doctors, and because that's our audience for the most part, and curious ones, they still, work in these hospital environments, and then they're still involved in table leadership in different places and spaces, and they're standing up for their patients, and they're standing up, amongst their peers to say, look, I remember one story, look, you got to do better. She's saying this to her peers. What's, one memorable story that you are thinking like, oh, that was a really good moment. And I think administration and my peers, they got that, like what I was trying to communicate as a leader.
Well, I think there are a lot of different ways that has really come to the fore. But honestly, I think it was leadership during COVID, and some of what we needed to do and how important clinical knowledge was, because we were really learning as we went. And so having to really listen to the clinical voice of this is what's happening with our patients. And so administration and the hospital leadership and, and practice leadership needs to figure out how to facilitate it, because this is something none of us have ever done before. And so I do feel like that was really a success, at least in my neck of the woods, in getting that clinical experience to be a lead in the way in which care was provided.
That's awesome. Yeah, it changed so much and so fast. It was like what happened in March. It was like, wow,
Oh,
this is now out to the public in July.
Yeah. I mean, all the tragedy aside or notwithstanding, uh, it was so intellectually stimulating because you had to be constantly evolving and really trying to figure out what the next best thing was under, some really dire circumstances. So yeah,
Well,
I'm very grateful it's behind us,
yes.
at least from that pandemic standpoint, but it was certainly an experience none of us will forget.
What I appreciate as a patient, on the recipient side of, so many physicians' insights and care and time is that it did put them in a position where this is not business as usual. It is, we have to adapt. We have to do something different. And it's not just, well, this is how we do it around here, kind of mentality. And it's in many ways, a lot of practices are back to that already, because that's feels normal.
Right.
We were interviewing and a bookkeeper not long ago, and she was discussing the practice finances of a medical office, and it was so when you give them the answer key, because my wife's a teacher, you give them the answer book, 16 things you need to do, the levers you can pull.
Hmm.
um, how many of them actually pull those levers to say, I can put my practice in a better financial space in the next 6 months, 18 months, or things are going to continue down the road that they have been or get worse. And she's like, probably 20% will pull those levers. And it was, well, why? What do they do in response? They just put their heads down and work harder because that's what we've, you know, been taught and trained to do. And speaking of the next
And we need
best
to
thing,
work smarter,
go ahead.
not harder. I mean, that's the thing. We have physicians work really hard, providers work really hard. And yet, uh, the amount of information that's out there can still be overwhelming. We have to work smarter to be able to, and I know that's a cliche. I'm not inventing that phrase by any means, but I think it's really applicable here. Expectations are really high, both of ourselves and from our patients upon us, and the whole rest of the environment. Expectations are high everywhere, and in fact, we can deliver really excellent care. We just have to have the tools to allow us to work smarter.
It was funny. We talk about expectations as a patient because I'm not a physician, but I am a patient. So I know what it's like to sit on the other side of the exam room or service window or text thread. And what I remember giving a talk about patient expectations to physicians. And she came up after as people normally do, a few, if you're lucky enough, sometimes people will come up and talk to you like, yeah, that was terrible. And oh, that was great. Um, but she came up and she said, you as a patient have really high expectations of us. I was like,
Yeah.
of course, because you're probably one of the top 5 most influential voices in my life behind my wife and kids. So, of course, I have high expectations and I need to lower them in some ways. And as you walk through life, as a patient, you do unfortunately lower your expectations. You do expect a wait. You do expect, I don't even know if Dr. McGraw is going to be here today. Like, no idea. Nobody told me that I was going to be seeing this practitioner. And so that's difficult to be a patient these days, as it is to be a physician as well. There's a patient burnout in our culture that's happening rapidly as well. However, what you guys are doing over there at Guava is, I think, changing things. And this isn't a
Yeah.
sponsor. This is
Yeah.
educational. We want,
So exciting.
yeah, absolutely. So you've stepped into this chief medical officer role at Guava Health, and you can go to guavahealth.com, Guava. I love that name because it reminds me of guacamole. Um, but what surprise? Well, tell us a little bit about what you do at Guava and what Guava does.
Sure. So, Guava Health is for most people's experience, for patients' experience, it's an app that allows you to be the center of everything about you, from a health and medical standpoint, which is really unfortunately revolutionary. So for example, we as patients are used to the idea that we, went to the emergency department at hospital XYZ and we've got some information in the portal there. And our primary care provider is at practice ABC, which is not related to hospital XYZ. And so we have a portal there. And then maybe while we were on vacation down in Florida, we, broke our ankle or something terrible. And, so we have some records there that are kind of miscellaneous out there. And then, that's what we had. And we're very peripheral to all of those different organizations. And what Guava does is it's an app that allows you to bring in all of that information from all of those different portals. We have over 50,000 different connections, as well as all of your wearables. So in one place, in that one platform, is all the information from your CGM, your continuous glucose monitor. If you have a smart blood pressure cuff, it can be from that. All of the information from your Fitbit, your Apple Watch, your Oura Ring, your Garmin watch. Any of these wearable devices. It also brings all of that information into the app. And so in one single location is everything about you, all the notes, all the data, all the information. And it's not just housed there in a big soup. It is organized in a way that allows you to look at it. So if you have a lab from, hospital provider ABC, and you have that, your creatinine was checked there and it was checked at another facility, normally you wouldn't be able to look at those and see any kind of trend over time, but we intercalate all of that information from a source agnostic standpoint. So it doesn't matter where it came from; it's across time, and allows you to see trending of information. And then, in addition to bringing all that information, it also allows you to track things. So if you're monitoring, you need some help remembering to take your meds, or you're trying to track your food intake, or any of these other kinds of tracking kinds of things that you want to do, it enables that. And then it will look for insights of what things are related. So, has your sleep been worse since that medication dose was changed? Like, we're guessing, right? We don't really know. But I say I mean, we as patients, we don't know. We say, I think my sleep was a little worse, or really, it was been since that exact time. What a surprise. And then that provides you with information that you can then take to your provider and say, hey, this medication, we adjusted this dose. I'm having problems with my sleep now. Can we work with this a little bit more? I think there might be a connection here. So it provides these kinds of insights. You can test insights against each other. And excuse me. And then it'll also show you, you can have, there's an assistant that you can ask questions of your record, like how has my cholesterol been trending over the past few years? Or, there all sorts of information about you. And that is, I think, something that's really, really different, because we as patients haven't had access to be able to have all of that information together. So that's one side of what Guava does. A second side that Guava does is on the back of this really excellent consumer product or patient product, is a provider dashboard product that we have. And that allows a provider to be able to invite their patients to join Guava. And then, and the patient, gives permission, because we're HIPAA compliant and data secure. The patient controls yes or no, I'm going to, allow this connection. And so what it means is that a provider can then have a dashboard of all of their patients with all of the data from Guava. So that'll be, real actual integration of, the notes and the information, not just there's a PDF in there somewhere, but everything gets extracted from those PDFs and intercalated into the data there as well. So a provider can see the whole range of information, not just from a patient's portals in 6 different locations, but also all their wearables, and be able to see really the whole patient, a complete patient. And there's also a section that provides highlights, so it allows you to see, kind of what you need to be paying attention to that has changed within a patient's record. And so it's really providing clinicians a leg up on managing all of this information that's out there in a much more complete way. And also with the assistance to be able to actually achieve that, not just have a big pool of information that tear your hair out of. I don't have time to look at all of these things. And what if something comes in and I don't notice it, and et cetera, but really in a way that can create for you, hey, there's some change in this person's blood pressure. They're on a couple of antihypertensives and yet their blood pressure is still going up. Well, great. For me as a clinician, that tells me I have an opportunity to intervene there. And that information is available to me in a whole different way. I don't have to dig for it and try to figure it out. I can figure out how to respond to it and make the changes necessary. So that's what, so Guava has these two pieces, the consumer product and the provider dashboard. So that's what Guava is in not exactly a nutshell, a little longer than that, but nevertheless. So my role, your second question is, what's my role at Guava? So I've worked with Guava. We've been around for about 5 years, and I've worked with Guava in one format or another for about 4.5. When it was just getting started, I was an advisor to the company as we were starting to work through some of the configuration of how to be displaying some of the labs and that kind of thing as we're all putting it together. And my role has really grown. And about a year ago, I transitioned to working much more in a much more focused way with Guava. And so as a chief medical officer, my oversight is about the medical integrity because we want to make sure that this is right. Some of the ethics stuff around that as well. Some of the compliance and aspects of it, but also what makes sense for our product, for physicians, for users, to help understand where the concerns are, how we can improve this to make this better. So it's a wide ranging role, but we're, a small firm, so everybody wears a lot of hats, and it's really just, it's so much fun. It's a great team of folks. We have really fantastic software development engineers who are really, very mission driven in their approach and really brilliant. And it's just a ton of fun. And just feels like a really good place to put my energies into for really just help transform what is medical care right now.
I love that. And it sounds amazing, especially from my seat in the exam room, is that I would love to have even have the Garmin, app on or connection there. I mean, 50,000
Yeah.
it's a lot. And um, I love having, as a patient, all of this information on my devices. I think that I kind of wonder, what will healthcare be like when my kids are my age, or, and it's like, how are they differently interacting with apps and their health and
Yeah.
making informed decisions.
Right.
Um, but also let's talk about um, physician response to all of the data. What have you seen? What are you hearing? Because the bundling, unbundling of healthcare, it's like, well, I'm already overwhelmed, because I'm overworked. And how do you answer those questions when those physicians ask that type of question?
Sure. Well, kind of one of the funny things is that there's all this data out there, and patients expect that we have access to all of it because they know it's all electronic. There's electronic medical records, and it's so unfathomable to them that these are not all connected. Shouldn't they be? Is the expectation from a patient standpoint? And they're not wrong. It should be, but it's not. And it is all these separate pools of data. And, sometimes there's some connection, but it's messy and it's difficult to deal with. And so that's one of the really difficult things is there's vast quantities of data. Patients assume we have that all. And in general, the reality is we don't.
Yeah,
Uh,
I went across the hall with my daughter to the practice across the hall.
right.
Across the hall, I mean, it's like, well, they're part of the same group, and like, nope. we don't have any of that. And then when I remember I became a citizen because I'm Canadian by
Uh-huh.
default. And I remember that day I took my certificate and I went up to the DMV. I was like, I'm ready for my 10-year license. And she's like, oh yeah, you're not in the system. Like we don't work that fast. I was like, oh,
Right,
anyway,
right.
I
So there's
never.
this assumption that we should have all this data and we don't. So from the get-go, we're working in a very, in a way that doesn't allow us to really move forward in the ways that we want to. So there's on one hand, we need more information, right, as physicians. On the other hand, there's so much information out there that it's a stress and a worry that are we going to be able to keep track of everything? Are we going to miss something? I mean, I think that is like a core worry for most physicians that we're going to miss something and not see it. And the human brain sees things that are out of place, but is less likely to see things that are missing. Right. And so there's that aspect of missing, but there's also something that is there that there's so much information we just don't even see it. And so overwhelm is such a big thing. People's inboxes are full, the messaging is full, and there's so many labs for them to review. And in the context of each patient, trying to keep track of all of that is really, really difficult. So I think that, for the provider dashboard, one of the things that we just get a ton of feedback is, oh my gosh, this is amazing. Oh my gosh, I had no idea. Oh my gosh, thank goodness. And because it is pulled together in a unified way to be able to see it. And not just that, but it also can be synthesized. You can ask questions of it, and there are automatically things that are to the fore for you to pay attention to, my example on the blood pressure for at being one. And so there's relief about how to manage this overwhelm of data, because even, it's this funny juxtaposition. We're overwhelmed with data, yet we know we don't have it all. So like, how terrible is that? I need more of what is going to overwhelm me more. But Guava brings it all together in a way that makes it manageable, and really, provides the support, as I think I mentioned before. It provides the support for physicians and other care providers to do what they want to be doing, which is providing really excellent care to their patients, not missing things, not, and being able to provide the context that is necessary for that care. So, um, yeah, I'd say that's sort of the main reaction that we've gotten is, oh my gosh, this is amazing. We were talking with a provider organization recently, and the fellow was so excited, and he's like, I mean, I hate to use the word silver bullet, but this really feels like a silver bullet. And so that was just really, exciting, because it's so gratifying to know that we're making a difference in patients getting what they need and providers being able to actually functionally do that in a way that is not just draining them dry.
Yeah, I love that. And um, I am one of the comments I got a couple of years ago from a physician who was a listener. He's like, "You ask all the pesky questions," and then he's like, and then he wrote a follow up email. He's like, "I didn't mean that as negative. I appreciate that."
Oh,
So,
good.
and I appreciate that as somebody who is a words of affirmation kind of guy. But um, tracking and notifications, device connection. Let's say I'm a physician, or you're my physician and I'm the patient, more accurate. And and again, I might be wrong on this, but I'm thinking the FAQs or challenges if I'm a physician learning about these types of things, because I've been pitched, these
All right.
all in one great all data solutions in the past. Is it's too much data. There's a mindset especially among family medicine, primary care, that look, we are the center of the universe here. And that mindset, I think, is slowly changing, where, we're not going to, as patients, go get all of our answers from just you, because you don't have time for us, right? Like we're going to have to go over here to this specialist, and that specialist is not talking to your practice. And so you're not getting the information. So I'm having to drag all of my medical records with me in paper, or hopefully send you just the most important stuff. So let's say it's all now connected in this place.
Yep.
And there's a few questions here, a couple. Physician responsibility for it. Am I getting pinged? And, I open my phone on 8 a.m. and I've got 137 notifications that, about 17 different patients, because now the data is continuously updated. And maybe again, I'm wrong, but I'm thinking about this from
Yeah.
like, oh, okay, now I've got all this data. It's amazing. But how am I now responsible for it? Is a FAQ we often hear was like, well, what if I see it? And then it's like, oh my goodness, what about all that? And then the notification part's like, okay, this new data just came in from these 3 different things about this patient that has these chronic conditions. I'm getting alerts, or am I getting alerts? Or how do I utility wise function with Guava as a physician?
Yeah.
So there's a lot to that, and probably incorrect, but
Yeah,
from a
no,
patient's
no,
perspective.
you're spot on. These are absolutely concerns we are addressing every day. So Guava does alert you that there are new records, but it's not going to be pinging your phone and jumping in ahead of the text message from your daughter or anything like that. It shows up that you have new data. On the tab, there's a thing that shows you that there's something there that you haven't looked at, but it's not going to be harassing you about it. You can look at it when you're ready to look at it. It will, alerts will come through for, things that critical information, things that are out of range and that kind of concerns. Those will come up and show up. You'll see some of those will end up surfacing through the highlights section that I had talked about. So you'll be able to see it. You'll be able to do it in the time that makes sense for you. You can also customize the way that your alerts come through so that you have some control over that as well, about what you want to see. In fact, there's a lot that's customizable, because you can customize, your data ranges. You can customize. So we have a health score that you can customize for your practice or with, particular patients. There's a lot of customization available. However, I will add that I know that endless choice is not better. Endless choice is a hassle and a burden in and of itself. So we've really tried to set it up that the default of everything is something that is exactly the way that you would want to work with it. But if you have a patient population that you're working with on a specific topic or a particular issue, where there's some patient that you want to have some different kinds of high touch hands-on of the way that you're managing the data that's coming to you, you can make those changes. But the out of the box approach is going to work, in most use cases, because, as I said, more choices. I think back to the days on when hospital I was working with went live with Cerner, and there were so many choices for everything of, so that ended up even with like blood pressures being documented in 16 different ways, which, in 16 different locations throughout the record, which meant it was really hard to find out where's the blood pressure, because there were too many options, because nothing was, set up to work kind of out of the box in that way. So yes, all these alert functions are there. Yes, you can be aware of the things that you have not seen yet, but you are not going to be bombarded in a way. We're trying to make this really functional. So, we don't want to have emergency notes to you that your patient took, 6,000 steps instead of 7,000 steps. That's ridiculous. But at the same time, if, your patient has taken 1,000 steps and they used to take, 12,000 steps, and for the entire week they've been 1,000 steps, well, you might actually want to know that, because maybe they're sick and haven't given you a call and you need to check in on them, but then again, it depends on what kind of practice you have, about whether that's something that is typically the way that you work. You're a small enough concierge practice that is something that you could be looking in on, or, are you larger and you do things differently? So recognizing there's some different ways people manage it.
I love everything I'm hearing as a patient, and, putting my dad hat on and I can see that it might not happen in my lifetime. And it probably, given how slow healthcare is to adopt new things, it might not happen in my kid's lifetime, but I hope it does. Where what you're talking about, and you feel free to riff on this because you as an important leader and role in business and technology, and especially in healthcare, and having a physician background and all the other things that you've done and accomplished, I could see that one day, hopefully, doctors will have a lot less patients that they can manage, and that there will be more doctors out there too, and that we'll use, specialists, and that those specialists will communicate with the others, with the primaries and all that. But where, you know, you could almost see it, and we may never get this, but where, okay, they took, 1,000 milligrams of this, that would require some really in-depth, but like glucose monitoring. And, there's all kinds of apps. My dad's a type, my dad's an insulin to multiple shots a day type of diabetic. And he's looking at these new things as a 70-year-old. I was like, that's awesome, Dad, but it's up in Canada and it's very interesting. So I don't know. I would love for us to be able to finally get there to that one day where it's like, that doctor only has a few hundred patients. And he's like, hey, Michael, I just see that you took, this, or I see that you just had hip surgery, all these types of things. So it's more of a commentary than it is anything.
Yeah, I think we are there in this concierge movement, in that, it's not uncommon for practices to have a smaller number of patients, to even just have 100 patients where they are much more high touch in terms of their connection with patients. Um, and I would also say that I think that the advances we're making with respect to AI and our technological connectedness is going to make it easier to manage even a little bit larger patient panels, because it changes the role that the physician plays relative to the patient, in that the physician then works with the patient on what their options are and what is going to suit their lifestyle and their progress, and that kind of thing, and helps them select between treatment plans. You can get a variety of different options now, with all of the resources we have of various treatment protocols, and AI is really, I think, helping that, and will continue to really revolutionize the work that physicians do, so that we are able to be much more of a patient partner in the patient's wellness care, or chronic illness care, or, critical illness care, frankly. And rather than just trying to make sure that they're basically not falling off the table into poor health, and trying to rescue them back up onto constantly trying to pull people back up onto the table of, okay, you're stable. It's okay. I'll move on. I think we're at the cusp of such big change. I often refer to healthcare as kind of convulsing right now with change, and change in healthcare. You talk about it being really slow, and I think institutionally that has been true. Um, but I think technology has been leaping forward so quickly, and frankly, our consumer focused customer experience world is also changed that conversation. And so I think external to the organization, the demand around change is so strong that it's almost creating its own pathway, and some of the organizational change is going to have to run to keep up. But I think that is already happening.
So how do we get more doctors there to that kind of, I mean, because there's a lot of, that's a great idea. I'm in agreement with all of that,
Mhm,
but
mhm.
that's not how we do it here. Or I just don't have time for that. I love that idea, but we just don't have time for that here. So it's standard of, that standard of care, which is kind of almost a mindset of definition of, well, I was taught this, I was trained to do this. This is how we've always done it. And we're not going to be changing anything because it's too difficult to change. And, you know,
Well, yeah. So one of the things is that the folks who have agency to change the way in which they deliver healthcare, is certainly those who are the small business owners. So the smaller independent concierge or direct DPC or, independent nurse practitioners, any of those folks who are not part of a larger hospital system per se, but smaller business, they have agency to make those changes. So, that's really a place where we have really been starting, is working with folks who can say, well, I'm willing to give this a try, or I'm interested in giving this a try. And one of the things we do with that is, well, there's two things that we do. One is we encourage folks who are interested to open up their own Guava profile and see what it's like from the patient experience. I mean, we started as a patient application, right? So we cut our teeth on that and got tons and tons of feedback so that it works really, really well from that patient experience. And so then we built that provider dashboard product on top of the knowledge of that. So I think that it's unique in that way. So we say, get on the patient experience part, try it out for yourself and see what it's like. And then the other thing is that, and play around with it, because then it's about your own medical data and you get the win of, oh my gosh, I'm seeing all of my stuff here. And oh, well, look at that, look at my HRV and how it's changed. And, you can see all of that and understand sort of the power of it in a very personal, HIPAA compliant, secure way. And then the other thing is that with our provider dashboard, you can start working with it with just a couple of patients for free, no commitment, so that people can play around with it a little bit. Invite a patient or two that they know might also be interested, and see how it works for themselves. So it gives an opportunity, sort of that no commitment way, to be able to play around with it. And then, we've committed to making it really affordable for these concierge practices, because those are the folks who actually can take that step forward, have the ability to do it. And, that institutionally, that group of folks who are employed, so, with the large organizations, the Kaisers, the Mayos, et cetera, that's a little bit different, because those physicians don't have as much agency around what they're using. But nevertheless, even in those organizations, there are some practices that do have more agency to be able to trial things out. So it's really about figuring out where that agency exists. Because if somebody has the agency to say, I want to try this, or I am going to try this, we're right there. And, I think people really very quickly understand the value of it.
I love that. And it sounds like, if I'm a physician or a patient, regardless of that role, that this is going to be something that I'm going to be using a lot, but I'm also going to be like using for a long period of time. And that kind of goes back on the patient side, asking that pesky question of being a patient. 50,000 partnerships, it's amazing getting all this health data from all these other places. Has there been difficulty from a patient's side of the exam room, that that organization wasn't letting that patient have their records? Who owns the records, right? There's that kind of conversation in healthcare of like, well, if I'm employed, well, then now who owns the patient? And then
It's actually very straightforward, in that it was legislation that said that all of the EHRs have to have patient portals that are available to patients to be able for patients to be able to see their data and direct what happens with that portal. So and in fact, if an organization doesn't provide that portal and allow exports from that, it's considered information blocking. And there is penalty actually for information blocking. So the question of who owns the data is patients own their data and have access to it and can make a decision about where it goes. That has been settled. So in terms of getting the information from one place to another, a patient can say, that they want to do that. Now, so with Guava, one of the things is you can share, so you have a profile, right? So as a patient, you have a profile on your phone, you can access everything. You can see that note from the neurologist. You can see, what your, most recent cholesterol was and anything else that you want, it's all right there, right? And then you go to the emergency department for a visit, or, because you tripped and sprained your ankle or something, or you go to a new provider. You can share your profile and determine how long you're sharing your profile with that clinician so that they can see it. And you can actually make it so you aren't sharing 100% of everything in there. So if you have some sensitive data, like you don't want to show your period tracker, for example, if you want to hold that back, you can hold that back. So you can make some decisions about what you're sharing, but you also time bound it so that it is not a forever event if you don't want it to be forever. So you actually can.
So this is portable as a patient. I can take it. I'm no longer seeing this doctor, not necessary anymore, but I can show my current doctors what happened there.
Absolutely.
I love that. So talk to us about the engagement with physicians. How do I get engaged as a physician? Because it sounds really good, and it also sounds like, and let me say this too, this is more commentary, and you share as well what your experiences have been is boundaries when it concerns the worried well, because they have patients that might be interacting with this and they're like, oh yeah, and you know how the worried well are. They send stuff to their doctor. They ask the pesky questions all the time.
My daughter.
I don't consider myself a worried well, but I definitely worry. However, I think that's more of a commentary on your boundaries and communication policies with patients of like, well, they sent this at 9:38 at night, and I don't know if I should listen. It's like it's just a hard it's just their PDF, of their blood pressure. So you're welcome to riff on that, but also talk about the engagement. What's the next step for physicians listening?
Sure. Yeah, yeah. So to start with the boundaries and the worried well question. So, let me just say to start with is that when we talk about the worried well, we also have to be really careful that we are not providing medical gaslighting, because that's a real thing as well. And we end up throwing, the proverbial throwing out the baby with the bathwater. And I think that that's one of the things that Guava is really helpful with. And what we've heard from patients is really, Guava is super helpful with it, which is that we provide the data and we can look and see, are there correlations? So if somebody's worried about their blood pressure, we can look and see, is there a statistically significant correlation? Now, we're not talking about causation. That's where, your MD hat needs to come on and you need to, think about it. But we can provide whether there are statistically significant correlations between different factors. So that will help dig down a little bit to decide, is this just a worried well consideration, or is there something there? The other thing that for patients that are sometimes seen as the worried well, they're often they have an issue that's been hard to diagnose, and so they've gone from provider to provider with it. They don't necessarily have the right language to convey their concerns because they're not medical conditions. And so Guava can actually help provide all of the data that's been obtained in all of those different locations. And we hear back from folks that it has been helpful for making some difficult diagnoses, because patients come with the data. So it's not just, I think I've been feeling worse, but here's the data that actually shows how I've been feeling, get the data behind it. And it has prevented folks from having to get repeats of lab work that they've already had, because the doc can actually see it because it comes with them. Prevents repeat studies. It has prevented repeat step therapy, step therapy being, you start on one medication and that doesn't work, then you go to the next one and you go to the next one like that. We patients have a very, myself included, have a hard time keeping track of all of that kind of thing normally. Of like, oh, I think I took that one doctor prescribed that for me. I don't know. I took it for like, I don't know, 2 or 3 months. I can't, that kind of thing is not, I mean, I think we can all recognize that. But Guava lets you have that as actual data and consolidate it in a way that a provider can then look at that and see that whole picture. And so it helps discern, is this a worried well situation where somebody just really needs that reassurance? Or is this something that there's something there that we haven't really been able to pin down? But when you pull all these pieces together, it becomes more evident. So I think that that's one of the tremendous things around this concern around worried well, is that actually provides some context for it. You mentioned about boundaries. So we do have in-app messaging. You can set up as a practice, you need to decide what your boundaries are, right? So if your boundaries are, if a message comes in after, 6 p.m., that there's a little note with it that says that, messages after 6 p.m. will be reviewed by 10 a.m. the next morning, or whatever your practice approach is, Guava can support that. And so, but the key is that as a practice, you need to understand what your boundaries are and what you're looking at it. As a practice, are you answering every phone call in 5 minutes? That's an extreme, but if that's what you want to do, then that may be your business model. I don't know, but but you have to define that as a practice, and then Guava can support that. To get to check it out, guavahealth.com is our website. And if you go to guavahealth.com, you'll see across the top, there's a section that says for providers. You click on that, it'll bring you right up. And you can set up an account, which is not signing up to be a Guava provider. It's you set up the account to get access. And like I said, you can try it out for free with a couple of patients and see what it's like and trial it out. And you can also, when you do that, we'll, be in touch with you so that if you would want to have a conversation with any one of us, we're totally happy to do so, and to do, more elaborate demos. If you want to figure that out, before you even sign up, any of that is possible, but all accessible by just going to the guavahealth.com.
This is amazing. I'm looking at weather insights. I've loved that. I remember getting my whole genome sequenced and downloading an app that worked with just the weather app. Not
Yeah.
that it was a specifically designed weather app for that. And I was like, yeah, even though it's overcast and cloudy today and rainy, you probably still want to wear a 50, and it was like, this is where we need to be, this is so cool. Now there does seem to
The weather insights, you can see, is there an impact that is really, consistent for you with your headaches or your, whatever your energy level is, or if you want to track your mood, you can then see, or does it impact your mood? I would say probably for most people, yes, but who knows?
So it does seem like awesome. And then there's that fine line of like, okay, I'm inputting my data as a patient, and that fine line of like AI use and integration. Talk to us a little bit about that.
Sure.
And
Yeah.
then
So
the app not being the physician, right, itself, but also, this is maybe another rabbit trail, but feel free to jump on it, is new evidence, and I know evidence can take a long time to get published and apply, but is that also being integrated into this as well to help the physician on the other side look at this, interpret these things, or am I incorrect?
You started your question, I think, a little bit around data security. So we are HIPAA compliant. Your data is secure. We don't sell your data. We don't have ads on our website. And you are really in control of your data. You get to decide who sees it and when they don't get to see it. And in terms of AI, we do use AI, but we have a contract so that there is no data stored outside of our environment, and there's no learning that happens based on our data, so that your data really is yours, not shared, broadly outside of our organization. So it's really important that you, as a patient, this is all about you. It's all the most critical, sensitive information about you. I mean, you can track anything you want to within that app, as sensitive as you want it to be. And then, map that against, or have the program map that against all of your other data. So if you're trying to figure out some things that are really, really deeply personal that you wouldn't want, be sure that wouldn't want published or broadcast, it's fine. You can do that in Guava. It is secure. It is yours. And so, it is integrated, we have, integration with Elation, Health, and EHR, and we're working with some others. But your data within your Guava account does not, it really is yours and is secure. The evidence, new evidence. So that is such an ongoing, rapidly changing arena. Certainly what was available to us to use and think about and how we pull it together was very different a year ago, 6 months ago, 3 months ago. We are constantly, updating our approach with it. We are constantly evaluating the AI that we use to see what's out there. Is there a better approach? And I think, what we do now will continue to change. It has to. It has to. I think about, as a clinician, when I'm just going just for straight up data info, I used to just go to Up to Date. That was I used to go to Harrison's, but I'm dating myself. That was a book. But we all use Up to Date, and now there's Up to Date, there's Open Evidence. Frankly, there's Google, which is much better than it used to be, and ChatGPT and Claude, and there's so many options out there right now, which is really, I mean, that's amazing and great. I think such an advantage. So we continue to really evaluate and update what we're using so that we are sure that we are providing the best possible information that we can.
Well, I love that. And I can see so much as a patient. What happens when I'm a patient and I decide, like, I don't, like, is it expensive as a patient? We don't need to get into the granular details of,
No,
but
no.
it's like, I would be afraid to leave because it's got so much of my health stuff in it that it's so good. And it's like, well, my doctor's retiring, so I got to inform the new guy, or, I need to go to these other specialists, and all that data's there. And then it's like, well, it's like subscription
But it's
fatigue.
okay. It's okay. Because it's not expensive. So the cost as a patient, the base model that doesn't have all of the whistles and bells of the Guava assistant, and all of the correlations and insights, and some of those things that require us to do more are the part that costs for the subscription. But the base model is actually free.
I love that you use base model because I just had to deal with car stuff, and as a consumer, which we are, those are terms that I would love for more clinicians and physicians to start using because we are consumers and we're not going back to how things
No,
were.
we're not. So the base model is free. It has all of your data. You can bring in all of the data. You can, upload, you can take pictures of your documents and upload, but some of the more whistles and bells where we need to actually do things to synthesize it to bring it back to you. That's where there's the subscription cost, and it's $8 a month, and there's a little bit of reduction for doing an annual a subscription to it. But so it's not super expensive. $8.
So I upload some of my data, right? And like images to Chat GPT, and does it interpret them like
So we are
people or
not.
patients are using that?
Yeah, so ChatGPT might be doing that interpretation, but they're telling you that they're not practicing medicine and not really telling you what's there. They're just providing some information. The same thing is true. We are not practicing medicine, and we are providing you information about your data, providing you some ideas about where you might want to take a concern to your clinician, providing you insights about it, but we're not diagnosing and we're not recommending treatments per se. So that, we really are not providing medical care. We're there to assist you and assist your physician about that. And that distinction is really important. And that, that same thing is true on the physician side or provider dashboard side as well, is that we're not taking away any of the provider's autonomy around their own medical decision making at all. It really is their medical decision making that is going to guide this. But we're going to provide them with insights and support and information that they would otherwise have some difficulty getting to in that kind of synthesized way.
Well, last couple of questions because I want to make sure I get this one in. Let's say I'm a patient, I'm using it, I've got all of my data there. And you mentioned earlier in the interview about helping give kind of patients another language to be able to speak the language so that we can understand how to address this in the exam room next time I see you
Yeah.
of here's my question. And this is not my words. This helped me pinpoint so that we aren't wasting 30 minutes.
So you are getting at, thank you for bringing this up, because you are getting at one of our very loved features, which is what's called our visit prep. So let's just say I'm going to make up a scenario. Let's just say you've been having some problems with headaches for a while and you've been to see your primary care physician about it, but now you're getting referred to the neurologist for your headaches. So you can do a visit prep. And what that will do is to say, okay, so where are you going? What's the assistant comes up in it and assists you putting together a document that will bring in the complaint, anything from your past medical history record that's relevant to that, your different things that you have done to help to try to resolve it, who you've seen, appointments that are relevant, that you've taken, Tylenol in this instance and ibuprofen in this instance and other medications and here, and it improved it or it didn't. So all of that kind of information I'll synthesize. It will ask you as a patient, so what do you want to get out of this appointment? What do you think is going on? Because how many of us already as physicians know that situation where our hand is on the door, we're about to go out of the room, and the patient says, "Oh, doctor, I'm just really worried. Is this actually a brain tumor?" And then it's like, "Whoa, appointment is not over. Okay, let's sit down and let's talk about this," right? So putting all of this in, and sometimes patients know what's going on, right? Really in their heart of hearts, they know what's going on. So being able to ask those questions, put it all together, and then it's teed up into basically a SOAP note format for a physician to be able to, absorb. And it means that you can really start from there to and I think I didn't say that the assistant will ask you questions about it, so that to describe it in ways that a physician might try to be getting at what's going on, so that the whole thing is really teed up in a way that's really digestible and lets you move forward. And that is pulled together in a PDF format, with the lab data and everything else in there, but in a PDF format that you can then give to your provider, or you could just use it as notes yourself, so that it's the reminder for yourself of this and this and this and this is what I want to convey. I have my little script basically that I'm going to work with if you want to work with it that way. Either way, it is a very well loved component of the
Oh my goodness, why didn't we start with that today? That was we're at the price of admission. This is
great.
because we don't speak your language, right? Like you speak in all these acronyms. Yeah.
And all of us patients, we have terrible memories, like myself included. We all do, because let's just take that example of headaches. How often have you been having headaches? Well, I don't know. I think, probably, I don't know, 3 or 4 times a month, right? But if you actually track it on Guava, it will be able to tell you, actually, you've been having an average of 5 headaches a month since June, because it's documented. Which is really just so much better to have. It's so much more accurate than going, oh, I don't know, I don't 3 or 4 times a month since, I don't know, September or something. I'm not sure, you know. So it's a great support from that way.
Well, I understand now your enthusiasm. Like I get it. Like you go on interviews and but I totally get it. And as a patient from my seat on the exam room or in the behind the service window, like I love this. This is amazing, especially because we're so unprepared as patients and we don't know what we're walking into. And, we don't remember what you said, but we remember how you made us feel. And if this is part of healthcare, this is part of patient care, is treating what you're doing so much matters. And so I know everybody has their bad day we all get dragged down into parts of our job that we just don't like compliance, or, you mentioned that earlier. And it was like, somebody said, I think it was my mentor in college. He said, you're going to find the job you love. Let's say you find it. Well, there's going to be 20% of that job that you absolutely just hate, but the other 80% is worth it to get through the 20%. So this is amazing. And we're coming in for a landing here. I'll give you a couple of last minute questions that we ask of all of our guests. They're pretty simple. What book would you recommend or is on your nightstand or in your Audible list that you're listening to right now that you would want other physicians to read or listen to? Could be healthcare, could be just pleasure reading as well.
Yeah, the book that I'm actually reading right now is the book by Eric Topol on aging and longevity. So that's what I'm reading right now. Um, so I'll leave it with that. I mean, I think, we are learning so much about longevity. We have had to focus on acute disease for a very long time. Now we're into the realm of chronic disease. But we are entering into the age of longevity as well, which is really an incredible, um,
It is encouraging. Yeah, for sure.
yeah. So
Because it brings about new conversations, I find, with physicians about different parts of my healthcare. It's not I feel like the word wellness kind of got hijacked over the last 30 years. It's like, I don't love that word,
yeah,
but
it's interesting because, so guava has a lot of reasons why people use it. But some of it is chronic disease, some of it is, disease maintenance issues. Some of it is trying to get at diagnosis, and some of it is about wellness and longevity. And, I'm learning a lot about the field of longevity. It's not something I had a lot of insight into previously. So it's been an interesting read. Um, but it's I think I lost my train of thought in there. But
no worries.
there's a wide breadth of why people use guava, because it can be, oh, I know, it can be for some of these things. I think one of the things that is interesting about longevity is it's making leaps forward, but it's also tangling with how to ensure that the information that you're taking into account in your strive for wellness and longevity is actually science-based, fact-based, has good underpinnings, and um, uh, uh, isn't just the fad of the day, right? And I think that there's some struggle there, and so it's interesting to see there are some groups that are emerging now to have some more concrete, uh, uh, you know, gene based. You talk about it having your genetics sequenced, and having all of that as a part of the care is an interesting sort of new thread. And that's a field as well where folks really want, those care providers really want this wide array of information, and the wearable data and all of that kind of thing, and the custom lab ranges and custom health scores and that kind of thing that you actually can put together through Guava.
So if I'm a physician, what is my next step? Guava Health, we'll put the link in the show notes as well, Guava health.com. But Guava Health, you could Google it. I'm sure you'll find it. It's pronounced just like guacamole, but guavahealth.com. So what's the next step as a physician, real quick?
So if you're a physician who is interested in the dashboard, I would say go to Guava Health, go to the tab at the top that says for providers, and you will see that page. You will see the place where you can sign in and get entry to being able to play around with it. And there is a link on there to be able to request a demo or request some FaceTime with us. So we're happy to do that. And so it's really straightforward. And I'd also say download it for yourself. Do it, it's in the app stores.
Be a patient.
Yeah, be the patient and see what your patients are, we all want our patients to have really excellent experiences with the work that we provide because we put so much heart into it. We want their experience to be good. So download it as a patient and see what it's like.
So I would sign up as a physician, and then once I'm onboarded, I understand what it is, how it works. I've also tested it as myself as a patient. Then I get my practice administrator, and I start telling and informing patients like, look, you need to get this as one of my patients.
So
is that correct?
Yes. So you are able to invite your patients there's an email link. You can also do it as a text link once you send that email link. So, you can have a conversation with the patient. I am starting, you can send a message out to your patients, in a bundle to, a whole lot of patients saying our practice is moving to this. And so I'd like you to all, you're going to be receiving an invitation to join. And yes, it's real. And yes, it's me. Please join and send out all those links to those patients. Or you could do it on a patient by patient basis where, with each visit say, okay, I'm going to start be using Guava with, and here are the reasons why. And so, here's the link and I'd like you to sign up because it is, again, the patient signs up, it's free for them. It is, they get it for their side is the premium model, not the base model, but the premium model, and it's free for them. But they need to grant that permission to you as the physician because it is their data.
And is this something, obviously, this is a super simple question. Could you turn that into a QR code where I'm in the exam room and here's, just is what it is. Just scan this and it's going to get you all set up.
We have it as a bit.ly code that you can just text to them and then they can open it. Yeah.
So how come we're not using QR codes? I know that seems a bit of a pressing question, but it just seems simple as a patient from inside the exam room.
Yeah, we do have QR codes. In fact, I'm looking right here. So this will get you to the website to sign up. It's the QR code there.
Okay. So I could give that to a patient is what I'm hearing.
Yeah, you could get
perfect. That's what I was thinking, because how do I eliminate steps for the patient? Because I'm eliminating barriers, I want them to get on this, make it as simple as possible.
Yeah.
Well, our final question for you, Dr. McGraw, is one we ask all of our folks, and it probably will sound a little bit familiar given your experience in concierge medicine. At the end of the day, your role, what you're doing, physician, otherwise, what you're doing there at Guava Health, what do you want to be known for?
The threat is this about Guava Health or is this about me?
Probably just you.
Okay. One of the threads through my entire career has really been about patient access. And, so I've done that in a variety of different ways. I started a community health center. I started a hospital medicine program. I, started a program to get healthcare to patients who were unhoused. And so, it's really been about access. And I really see Guava as ultimately a huge opportunity for patient access to their medical information and physician access to that patient's medical information in a way that is otherwise not been obtainable. To do anything with that information, we actually need to know what that information is. And so I I am hopeful that in the end, I will have really provided a whole lot of people a way to actually get really good, high quality healthcare that otherwise they may not have been able to obtain.
Well, I love that. Dr. McGraw, thank you for your leadership, your perspective, for the work that you're doing to help patients and their practices move forward. For listeners, we'll link guavahealth.com for their insights platform in the show notes. If you'd like to learn more, please do. I think that, again, this is not a sponsored thing. Y'all didn't pay to be here. I just think that from a patient's perspective, and even from the listener who's usually physicians, this is a great thing. Like, this is where we needed to be. I almost wish it would have been here when we all started using our touchscreen devices. But thank goodness for folks like Dr. McGraw and the team that she's working with that are being innovative and are spending an incredible amount of time and intellectual energy and intelligence to really make things a little bit better for you as a physician, but also for us as patients. And if this conversation helped you think differently about leadership, data, the future of healthcare, please share it with someone who needs it. Dr. McGraw, thank you for being our guest today.
Thank you for inviting me. This has been really fun.